Yeah, we looked at the United States-based SEER registry, which is a cancer registry that includes about 25% of the United States population linked to Medicare. And we assessed patients 65 and older with Hodgkin's lymphoma and looked at pre-existing heart failure defined in the year prior to their lymphoma diagnosis. And we found that 13% of patients with newly diagnosed Hodgkin's lymphoma had pre-existing heart failure prior to their lymphoma diagnosis. And these patients were 50% less likely to be treated with an anthracycline-based chemotherapy regimen. So patients with Hodgkin's lymphoma, about 35% received a Doxorubicin-based chemotherapy regimen, and this number was 59% in patients without pre-existing heart failure. And patients with pre-existing heart failure prior to their lymphoma diagnosis had a 50% higher lymphoma mortality after their lymphoma diagnosis. And this effect was eliminated after adjusting for treatment, suggesting that the effect of pre-existing heart failure on worse lymphoma outcomes was mediated likely and in part through lack of anthracycline treatment. So, and then we also we were interested, there are medications such as dexrazoxane or liposomal doxorubicin, which can have been shown in other populations, such as the breast cancer population, to reduce the risk of heart failure in patients receiving doxorubicin. And we looked to see if these were used in the United States for these patients, which would be an off-label use because they're not FDA approved for that indication. And we found that that was not the case, that only about 4% of patients received dexrazoxane or liposomal doxorubicin. So these are really not being used. So suggesting that potentially, there is an opportunity here to improve the care of these high-risk patients with pre-existing heart failure, both through strategies that we have in management of heart failure. We have very effective medications to help improve the outcomes in patients with heart failure, such as sacubitril valsartan, beta blockers, SGLT2 inhibitors, aldosterone antagonists, all that help management of heart failure. So, really maximizing their cardiac medications, as well as potentially trials to look at whether additional cardioprotective strategies, such as dexrazoxane or liposomal doxorubicin or other strategies, whether that we could safely get more patients anthracycline-based chemotherapy and improve lymphoma and cardiac outcomes in these patients.